Welcome back to the Off Service Podcast. So with this podcast, I've always had a pretty limited scope in mind. This is a podcast about clinicians who have expanded beyond purely clinical work. But within that scope, I am interested in getting a diversity of clinical experiences. So I'm very happy today to have my first non-MD guest, Megan Ouyang, DVM. Megan, thanks for being on the show.
Hi, thanks for having me.
So as a way of introduction to who you are and what you're doing currently, can you say, tell me, what do you answer when people ask you, what do you do?
I usually always preface it by, it's kind of complicated because people, I still consider myself a veterinarian, but people are very confused when I say I'm a veterinarian. And then they say, oh, okay, so you like work with, like puppies and kittens. I'm like, actually I work with the public health department. And then they go, what?
Yeah.
So yeah, it's usually a whole thing. But yeah, I usually still tell people that like I'm a veterinarian and epidemiologist working for the public health department.
Yeah, when your job description is a Facebook relationship status, it's complicated. Yeah. That's how you know. You got trained for one thing, but then you expanded to something else, and it's hard for people to understand. And then in a few sentences, can you explain a little bit about what your current day-to-day looks like, and what's the split of clinical work to non-clinical work?
Yeah, so I mean, the majority of my time, my day-to-day work is spent doing epidemiology kind of things and for infectious disease at the public health department. I have very, very little clinical work that I do. It's something that I do on the side, maybe about once or twice a month. I'll do vaccine clinics for dogs and cats on the weekends. And that's really about the only kind of clinical facing thing that I do at this moment.
And then for folks that may not be familiar, we've had one public health guest on the show previously, but we didn't talk too much about epidemiology. What does it actually look like to do epidemiology? Is this largely a computer-based work, or is this very mathy? How would you describe it?
Yeah, I think it depends on where you work. Here at our county, the epidemiology work tends to be pretty computer-based and math-based, like looking at a lot of data, and you're looking for it for patterns, so that you can investigate disease. But like before I started doing this job, what I thought epidemiology work was like field work. I thought it was like going out there, looking at things, and then like being like a detective or something like that and collecting data. And I think, like two are perfectly valid. It just kind of depends on where you are and what the capabilities are.
Got it. And then where you are right now, you're at the County of Santa Clara Department of Public Health, right?
Yeah.
Okay. And so now going all the way back to the beginning, what made you want to go to be a veterinarian in the first place?
I think I have a very boring answer for this, in that like you talk to almost any vet and they're like, I always wanted to be a vet. And I think that kind of holds true for me. But I will say along the way, I changed my mind a whole bunch of different times. And then veterinary school kind of ended up being almost like a backup because I thought I wanted to do a bunch of different things. But I mean, after going into it, I was like, oh, okay, actually, I do really like this. There were parts of it that I think I decided not to go into clinical work pretty early on, actually. I worked as a vet tech for a while, and I was like, I don't think that this is for me, but I still really love working with animals. I love the medicine. I love the puzzles, and so I'm going to find a different way to continue doing this.
So that was before you went to vet school, you were a vet tech.
Mm-hmm.
And then, okay, so when you said, oh, it's a common veterinarian story, like I always knew I wanted to be a vet. As an outsider, I think there's roughly two categories that people who like animals, who want to work with animals, fall into. One is what I think people I grew up in like a city environment, think about little dogs and cats and personal animals. They're a member of the family. But then when I met like livestock type veterinarians, or like I met a guy who ran like a big poultry operation veterinarian, it's a much different approach to animals. Did you have a preference one way or another? Did you grow up in like a rural place or an urban place?
No, I mean, I grew up in the East Bay and in the suburbs. My parents weren't super into having animals in the house, but I just always loved animals. I would spend all my time in the backyard, like looking for bugs and stuff like that and trying to keep them as pets. And I think over time, I just kind of broke my parents down.
And you were able to get pets?
Yeah, like we started out small. I think as a lot of kids, it's like, oh, we'll start with a fish. Make sure you're responsible enough to like take care of your fish, and then eventually worked our way up to having a dog when I was in middle school.
Great. And so so you talked about having a few different interests, and veterinary medicine was one of them that you ultimately pursued. What else was on that list? You said bugs. Was one of them entomologist?
It was not. I think that was kind of more of a hobby thing, or like my intro to animals type of thing. But like in college, I double majored in literature and biology. I really liked literature, but then in the back of my head, I was like, well, maybe I still want to go to vet school, so I have to take all these prereqs anyway. So I would say literature was like, oh, it made my grades look really good and it boosted my GPA because it was something that I enjoyed way more than I did taking all the science classes. And I was like, oh, but I got to take these to like keep my options open. But when I went to college, I wanted to do marine biology. And I went to UC San Diego because I was like, well, where else are you going to go but to a place that has like a great Institute of Oceanography. But the year that I matriculated into UCSD, they got rid of their marine bio major. And like, I didn't know that like at the time, right? Because like looking at the catalog, it was like, oh, they still offer all these classes, but it was because it was for all the people that were existing there. But even when I was there, I still found opportunities to try and like get myself to get that marine bio experience. Like I went on a whole study abroad program that was like just for marine bio. And then I was volunteering in various labs at the Scripps Institute of Oceanography when I was there. And I also volunteered at the NOAA Fisheries has a center that's down there. And I really tried to make a go of it, but I realized that it just wasn't going to happen for me. It's a very difficult field to get a job in.
Oh, is that right? Because it's competitive?
Yeah. There's just like not, I mean, I guess depending on what you want to do, your options are either government or academia. And I was like, I don't think I want to stay in academia. I like this, but I don't want to do a whole PhD in marine bio. And then I was volunteering at NOAA, like I said, for a year and a half or maybe almost 2 years. And I was trying to get a job, but like just nothing really happened there. After I graduated, I stayed in San Diego for an extra 6 months, like working in this lab, like basically full time. Cause I was like, okay, I'm going to turn this into something. And when it didn't pan out, I had given myself like a 6-month limit. I was like, okay, I guess I need to move on to my backup, which was vet school.
Okay. And so am I right in understanding that marine biology then is not clinical, like you're not caring for marine animals, it's more research oriented?
Yeah, it's more research oriented. I mean, because I was still thinking about my like love of the ocean and love of fish and invertebrates, I was like, maybe once I get into vet school, I can eventually become like a fish vet or something like that. Like, I think a dream job would be to be the veterinarian at Monterey Bay Aquarium. I think that's a really cool job.
Wow. I bet that's competitive. I bet
it is so competitive. After I got to vet school, I still tried to do this for a while, and then like the reality of it hit me, and I was like, okay, I don't think this is going to work out for me either.
And so how long was it between when you graduated college to when you started vet school?
Let's see. So because I had not been super pursuing vet school while I was in college, like you have to do I did all the academic prereqs. I took the classes, but you have to get a number of like volunteer hours for your application. And I hadn't really been doing that. So I was like, you know what, I'm going to take some time off between, like applying to vet school. I'm going to get a job as a vet tech or something similar so I can figure out what this field is actually like and if I actually do like it. Because I think before you actually get any work experience, you have this like preconceived notion of what you think the job might look like. And I didn't want to waste all my time in school and realize like I didn't want to do that. So yeah, decided to get a job as a vet tech first. So I was a vet tech for 2 years. And at the same time, I got a job as a veterinary assistant because I didn't have a technician license. So I was a veterinary assistant. And at the same time, I had an internship at a wildlife rehabilitation hospital. So I was also a wildlife rehab intern.
Got it. And then vet tech, am I right in understanding that's sort of like a medical assistant preparing the animal patients drawing blood and things like that?
Yeah, I like vet techs it depends on the practice you work in. They kind of do anything and everything from like medical assistant up until nurse. So you do the things like drawing blood, getting a history from your patients, but you also like take x-rays. Depending on the practice you work in, you might perform dental cleanings. You might have to like scrub in and like be there in the surgical suite with your doctor. It's kind of a little bit of everything. And so the practice that I worked in didn't really have any licensed techs, so everyone did everything.
Okay, yeah. This is great. Like just before we started recording, we were talking about giving presentation to high school kids and like what advice do you share with them? This is a great piece of advice for younger people, if anyone younger is listening to this, where it's like exactly what you're saying. There's such a high risk of going through school, and I don't know what it's like in veterinary school. When do the clinical part of vet school start? How many years in?
You start at like the end of your third year, and there's 4 years of vet school.
So that's late. So you can do 3 years of studying, reading, and you're like, it's the same thing, just like college. You're reading. Maybe you love reading, you love studying, you like taking tests, you're good at it. And then in your 4th year, 75% of the way through your training, you're like, this is what it's like. I actually don't like doing this. And that was like my experience in medical school. School is school, whatever. That's what I had done my whole life up to that point. 3rd year, first rotation in a hospital. Devastating. Like, damn, this is what being a doctor is. Like, it's just as a personality fit, not really what I wanted to do. I wish I had taken some time to see what it was like firsthand. But you weren't scared away from it doing vet tech work.
Well, when I did vet tech work, I worked in like a companion animal practice, so like dogs and cats, et cetera. And it was like a pretty high volume, fast paced clinic. And so, got a lot of interaction with clients, different kinds of patients, different kind of cases. And there were aspects of it I enjoyed, like all of the pets. There were aspects of it that I didn't enjoy, which was most of the clients.
Okay.
And so I was like, I don't think that something that's client facing is for me. So going into vet school, I was thinking, okay, maybe I'll go into shelter medicine. I can work with mostly animals that are unowned. And so the only people that you're interacting with are like people who run the shelter. And like this whole time I was still doing wildlife medicine. And so I thought maybe I'll do like zoo medicine or wildlife medicine. Also animals where I don't have to interact with clients all the time.
Okay, so this is so fascinating already. So you use the term client facing, which I love because I always felt like when I was working clinically, and I was working in occupational medicine where there was like, it wasn't just the patient. The patient came with their employer, and there was always the insurance company you had to deal with. So it felt like customer service. Mm-hmm. It was client facing. I did feel like I was providing a service. It didn't feel like I have a sort of expertise and I'm pseudo academic and I'm just like getting to apply my knowledge. It felt like there was a lot of other interpersonal wrangling that needed to happen. It reminds me similarly of like the difference between adult human medicine and adult pediatric medicine, where it's like you don't just have to take care of the kid, you got to take care of the kid's parents. So that's something I had never considered, that if you do wildlife or zoo medicine, you don't have to deal with the owners, with the humans.
Yeah, I mean, so like that was a big part of me. I like love dogs and cats, but of course they always come with their owner attached to them. And so I think in vet med, there is a distinction between your patient, which is the animal, and then the client, which is the owner. And of course, everything that you do for the patient has to be interfaced through the client. Same, like as you said, it is client facing, especially in veterinary medicine, because things like pet insurance aren't as prevalent. People are usually paying out of pocket for all services. So there is a lot of that aspect of where you feel like you're selling things. And I really didn't like that part of it. So I worked for a very large corporately owned practice. And so they were kind of more about bottom line and selling services. And we were told like, oh, you have to sell like this package, or like maybe this month there's a special. So make sure that you talk about this to people. And I didn't like feeling like I was selling medicine to people. Like on the other hand too, it can be very difficult when you're like, okay, like these are all the things that we would like to do for your pet, like it came in sick and here's all the things we'd like to do. And then if someone can't afford it, you spend a lot of time like cherry picking what it is that you can do. Whereas like you want to give the best care to your patients that is possible, but money wise, maybe that's not possible for the client. Or maybe they just like didn't want to do something and you're like, oh, they're just like, just give me medicine. I'm like, well, I have to run some tests before I can tell you what medicine. They'd be like, well, like just give me something. And so you like spend a lot of time and energy doing that back and forth with people. And that was very exhausting for me.
Yeah. It sounds like there's a lot of parallels between veterinary corporate medicine and human corporate medicine. And I feel like I've heard some pediatricians call the parents clients and the kids animals. So I think there's
I think I have some friends who are pediatricians, and honestly, there's a lot of similarities. But yeah, I mean, like, it's like, okay, I love working with animals, and as a veterinarian, I think part of it is also being like an advocate for your patient, and sometimes the owners or clients aren't always on the same page as you. And so it's like, wait, like let's have a conversation to try and change your mind. But of course, that takes time. And when you are on a corporate hospital schedule, there's not always the leeway to take the time that you want to spend with your patient and client.
Yeah. And since you're the first veterinarian we're having on the show, I'll just highlight here for the audience that may have never thought about it. I mean, I've heard people had joked before where it's like, oh, veterinary medicine is like human medicine, except instead of one animal, you take care of every other animal. And that's like very, very true. And it's so crazy to hear. And even just the scope of what you're talking about, vet techs really being rad techs, being phlebotomists, doing dental work, it sounds like. That's fascinating. I think for people that maybe want to be generalists in a way, it's really there's so many different things you can do and pursue, it sounds like.
Yeah, I mean, even as a veterinarian, like as a doctor, if you work in, it's called general practice, you kind of run the scope of everything. Like if you're the person's family vet, you do all of those things.
And so did you have an idea of what your veterinary career was going to look like as you were going into veterinary school, and how did that change throughout school?
Yeah, so I mean, going into school, I was like, I don't want to go into companion animal medicine. I'm also just like a curious person, and I kind of took that generalist approach where I was like, I want to learn about every single animal. And it's okay if I don't know like super, super in depth about each one. I just want to be able to treat as many animals as possible. So because there are so many animals out there, in vet school, usually like your model animal that you learn most things about are dogs. And then you kind of extrapolate from there about other species. I mean, that being said, like like carnivores are so different from herbivores, and canines are very different from felines. But yeah, you start with dog as a basic. And I went to UC Davis, and they have this like tracking system where the first 2 years, everyone has the same curriculum, and your model animal is a dog. Even if you're like, I want to be a horse vet, you still have to learn about dogs those first 2 years. And then in your third year, they have like this tracking system where you can decide, I want to go into large animal medicine, or I want to go into small animal medicine. And then there's like a small number of people that want to do mixed practice. And I was like, I was a tech for a while. I know a lot about dogs and cats. I have like never really touched a horse or a cow. So I'm going to go into I'm going to like track large animal medicine. And so I decided to do the large animal track. And then additionally, like onto that, I tacked zoo and wildlife medicine, because I was just like teaching about everything.
And so that was not necessarily a desire, a priority to work with large animals, but to fill in a perceived knowledge gap or experience gap?
Yeah, I mean, I think I did want to learn more about them on some respect, because like everyone I knew who was working with like cows and stuff seemed very fulfilled by what they were doing. And I was like, I want to learn more about that.
Wow. Okay. So it's crazy. I know veterinarians. I'm good friends with veterinarians, but we never talked about this. That's so interesting. I never thought, it makes tons of sense that you would have to pick one animal and then just compare it to that model animal. So do they choose dogs because it's an animal that evolved with humans and everyone's familiar with them, or because their anatomy or physiology is somehow the lowest common denominator among them?
I don't really know why they chose it. I think part of it is just like dogs are so ubiquitous. Like so many people have dogs. And then right now, in terms of demand, most veterinarians become companion animal vets. So like they treat dogs and cats. So they're kind of just like catching everything by teaching everyone the dog as the model. I mean, like I said, if you're just doing like dogs and cats, you learn dogs and you're like, okay, cats are just like a little bit different in some regards. So you add on to that. And I guess we do learn maybe about a quarter of the curriculum is equine horses. So then that is like our like herbivore model. And then you extrapolate on to cows and goats and sheep, et cetera, off of the horse model.
Got it. Are any schools notable? Well, how many vet schools roughly are there in the US, you know?
In the US, there's getting to be more over the past like 3 or 4 years. A lot more vet schools have opened. But like when I applied to vet school, there was only like 26 accredited schools, not just in the US, like in the world. I think now there's 36 or something like that.
Wait, you said there was 26 in the world?
Yeah, well, accredited so that you can practice in the US. So there was like two schools in the UK that you could go to, and then you could come back here, take a test, and be a vet. I mean, I think there are many more vet schools out there, but it's not necessarily like an accredited curriculum.
Got it. Wow. That's and how many kids are in a class?
My class was one of the larger ones. So UC Davis, because it's a pretty like long established school, our class was like 140.
Okay, that's pretty small still. Okay. And so I'm getting off track here a little bit, but I'm so fascinated by the concept of model animals for the curriculum. Are there any vet schools you know of that stand out in that they don't use dogs as the model animal?
To be honest, I don't know a whole lot about other vet schools, but from what I've seen, most places use dogs as the model animal.
Got it. And so, okay, so you go to vet school, you're focusing on big animals and what'd you call it, wildlife animals?
Yeah.
And then what were your early jobs or what additional training did you do after graduation?
So I think something that's interesting about vet school is like you can do your 4 years of vet school, and as long as you like pass boards and get your license straight out of school, you can go straight into practice. You don't have to do like an internship or residency or anything like that. Like obviously you'll do a lot of learning on the job, but you're fully qualified to go straight into practice. At UC Davis, they really push people to go into specialty. So like a lot of my classmates applied for internship right out of school, with the hopes that they would move on to residency later. I already knew, I was like, I'm done with this clinical practice thing. And so I had applied for like a 1-year specialized MPH program. And that was like my internship year is what I consider it.
And that was at Davis?
I did at UC Berkeley.
Okay. And then during that MPH, did you have a focus?
Not really. There's a like special 1-year program at Berkeley called interdisciplinary MPH. It's an MPH program that's designed for people that already have some kind of advanced degree. So like you're an MD, or maybe you're a lawyer or a nurse or, optometrist, something like that. And then you want to kind of transition into public health or learn more about it. And so I was like, I don't really know anything about human public health. In vet school, we learn a lot about like zoonotic disease. UC Davis is really big on One Health, so I had a really good One Health background, but I was like, I don't know anything about our human public health systems and how they work. So when I went into that program, I was like, I'm just going to take as many classes as I can to try and learn as many things as possible.
And so I think I'm missing some connection here. So in vet school, you had known you were less interested in the client-facing clinical work, but did you also feel like you weren't excited about the big animal and wildlife clinical work?
Yeah, sorry, I skipped over that. No, I still was trying to pursue it. I wanted to do like zoo or wildlife medicine. Having worked in wildlife medicine for a while, I think that's kind of more of a passion, but I realized it wasn't really sustainable for me as a job. There's tend to be not very many of those jobs. They don't pay very well. I mean, how many wildlife hospitals can you name off the top of your head?
Zero.
Yeah, exactly. So yeah, there's not very many of those jobs, and they usually are like run by nonprofits, and so they don't pay very well. Or most wildlife vets, I would say, are someone that like has their own practice and they have like a, regular day job as a vet. And then on the side, because they enjoy wildlife medicine, on the weekends, they'll volunteer or something like that, their time and their expertise. And then when I was like, okay, maybe I'll do zoo medicine instead. Still really enjoyed zoo medicine, but also the reality of it hit me that it was going to be a very, very difficult profession or field to get into. Because once again, you think about how many zoos are out there, but very few zoos actually have a full-time veterinarian on staff. Really only the ones that are accredited and the ones that are large enough to sustain a vet have them on staff. And most zoo vets or zoos are looking for people who are boarded in zoo medicine now. So that would have entailed like a whole residency and everything like that. And I don't know if this is still true, but at the time, I think it is still true. There was only like 7 or 8 residencies in the U.S. for zoo medicine.
Got it.
And then, so I was like, am I good enough to compete for those 7 or 8 spots in the whole country, to get a residency? And then also, I think most people that become zoo vets, it's like your dream job, right? So once a vet got a position as a zoo vet, they just stay in that job for like 30 or 40 years. And it's kind of a timing thing. Like you have to be lucky enough that you can find a job and be able to slot into it.
The veterinarian becomes its own exhibit because they're just there all the time.
Yeah.
And you all lost a lot of wildlife and zoo medicine jobs when Tiger King got shut down. So that was devastating for your all's community.
I mean, I don't know if that guy was getting regular veterinary care for those animals.
That's true, yeah.
But yeah, I mean, like when I was in school, I fully enjoyed doing my zoo wildlife track. I got to rotate through like several local zoos and stuff like that. And I enjoyed all of it. And I was like, man, I wish I could do this as a job. But I was like, I am just not, I knew I couldn't hack it enough to go and like do a residency.
Yeah. And you bring up a great point, like for young people to hear, people that are in training, it sounds like there could still be opportunities to have a day job that's something secure and that pays the bills and that allows you to live like a human being, and then also have in your free time or have a volunteer activity that's still related to your passion and still be involved in it.
Yeah, I mean, that being said, I know plenty of people who went down the path, decided to do internship residency and are doing zoo medicine, and they've made it. And I'm like, wow, I'm so happy for you. I just knew that personally I couldn't do it myself.
And then, okay, so the program you went to, the interdisciplinary MPH program, that's a Master's of Public Health, was that a vet-heavy program?
No, I was actually only the second veterinarian who had done that program. Most of the people in my cohort were doctors. The Kaiser Peds residency required, like their 3rd year, they do this MPH program. And same with the UCSF, like OC Health, Occupational Health and Safety, like environmental health, that residency also requires, or it has this interdisciplinary MPH baked into it. So most of my like friends from that class are doctors.
Are there MPH programs that are specifically targeted toward animal population health?
Yeah, so I mean, there are some MPH programs that are like run out of vet schools. I believe Kansas State has one, and a lot of veterinarians go to that. Actually, like what I had applied for, let's see, Yale, Harvard, and Columbia both have very well-established MPH programs that a lot of veterinarians go to. And so they kind of are more targeted toward them in that they know like what veterinarians are trying to get out of it. And I had applied for all of those degrees, and I thought I was going to go to the East Coast for my MPH, but I graduated 20 in the pandemic, and I was like, we had to make our decisions by like April, May. And I was like, I don't think I'm prepared to move across the country in such uncertain times, especially if it's just going to be virtual the whole year. That like wasn't really what I was looking to get out of it. And so I was also accepted at Berkeley, and I was like, you know what, I can be close to home. If it turns out that we do get to go back in person, I won't have to suddenly like move my life across the country. And I still really enjoyed the program, but it was a little bit like, I did a lot of explaining what I was doing there.
And then how easily do you think the fundamental, like the more technical skills you learn in MPH, presumably you took biostats and epi courses, how applicable do you think that is to the veterinary side? Is that pretty species agnostic, like how you apply that?
Yeah. I mean, in vet school, we do get like a bit there. We have a whole block that is on epi biostats, especially I think as a vet, we work with large populations more maybe than like a human medical doctor would. Like in shelter situations, you know, you're working with a large population. But also if you do any large animal medicine, you're usually working with a large population. So it's like, you know, cows in a dairy, like hundreds of thousands of chickens in a barn, those kinds of things. And so you have to use epi work a lot to keep those populations healthy. And I think because I tracked large animal medicine, like I remember doing lots of like epidemiology exercises or biostats exercises, I guess, that are like, you know, like let's work out the timing for like when all of these cows are going to be like lactating so that we can make sure that everyone is on schedule correctly. Or we need to work out like what exactly your vaccination schedule is going to be for, you know, like 10,000 chickens or something like that.
Got it. Okay. That's fascinating. Okay. So again, it's very similar to human medicine part where it's like this shift from thinking about one-on-one, you're only worried about the patient in front of you, to a whole population. How can you do more like, it sounds like policy, even if it's just within an institution, within this farm, how do you schedule things and plan things, biosafety, milking, things like that. Okay. And then, so then after, what comes next?
So I didn't really mention this, but I was, throughout vet school, I was very involved in like veterinary emergency response. So this was like a club that I did through school, but then it turned into something more where basically UC Davis has one of the only like medical emergency response corps that's veterinary focused. So in terms of disaster, like a county or state can like call on this team's services and then will like deploy veterinarians to a disaster area. So in Northern California, this tends to be wildfires. And so I responded to like 4 or 5 large fires when I was in vet school. And I was still very involved in this like response group, even after I graduated. And after I did my MPH, there was a large fire called the Dixie Fire in Northern California. It was one of the largest wildfires in California history. And I spent like a month and a half up doing fire response for UC Davis. Yeah.
What is a veterinarian's contribution to emergency response?
I mean, it kind of depends on that area's needs and what they decide that they need help for. But it can be anything from doing search and rescue to like managing emergency shelters. So for the Dixie Fire, it was in Plumas County. They only had 2 animal control officers, and at the time there was no actively practicing veterinarians in the county at all. And so during this time of disaster, you know, like people are displaced. They were in active fire zones, not able to get veterinary care. And so the vets that we deployed kind of did a little bit of everything. There was like some search and rescue involved, or at least going out behind fire lines and like assessing situations to see like, is this safe for animals to shelter in place? There's also emergency shelters that were set up. There was like a large animal shelter that was set up at the county fairgrounds where people had brought like horses and like goats and ducks and, you know, chickens. Everything was in this large animal shelter. And then there was also a small animal shelter where there was like cats and dogs that were either, you know, like owned by people and they didn't have a place to keep their animals, or these animals had been like rescued out of some kind of situation and then brought there and were maybe waiting to be reunited with an owner.
Got it. Okay. And then you worked a little bit in emergency response, and then what came after that?
So after that, I was like, once again, I really enjoyed the emergency response, but another kind of position where it's so specialized, there's not really any jobs in it. It's another thing that a lot of people just volunteer for. And so I had heard about Cal EIS, which is an epidemiology like training fellowship that's run through the state. And I was like, I think I'm going to apply for this and just see what this is about. Kind of funny though, because I did not really go to school thinking I'm going to be an epidemiologist. So I didn't take any extra epi classes or anything like that. I took the bare minimum required. My MPH only required 1 biostats and 1 epi class. And that was like, and I took like intro to outbreak investigations. And that was like basically all I had taken.
Great. You probably learned a bunch on the job. And then so you did Cal EIS, which is through the California Department of Public Health. Mm-hmm. That's a 1 or 2 year?
It's 1 year.
1 year. Tell me about that. Where were you and what kind of work did you get into?
Yeah. So applying for the program, I had no idea what I was getting into other than I was like, it's a 1 year epi training program. That was all I knew about it. But it is a kind of thing where you interview with several different positions, like across counties and state level, and you just try to find your best fit. I ended up being placed in Alameda County in their communicable disease division. Embarrassingly, at the time when I had done all these interviews, I didn't even realize that public health departments like had different specialties. And so when I got placed in communicable disease, I was like, how lucky that I ended up here, because I could have been placed in anything and I had no idea. Like I could have been in maternal child health, I could have been in general, like all these different things. And I was like, this ended up being a good fit. Not that the other things I don't think I, would have applied myself for. I just did not have the knowledge base at all.
Yeah. And what was that like? Any highlights of that 1 year training?
I started Cal EIS at the end of June. And this was the very beginning of the MPOX outbreak in the Bay Area. So I hopped straight into an MPOX emergency response.
Wow. Okay. And what was your involvement in that?
A little bit of everything.
Okay. Like your vet tech days?
Yeah. I think part of it was because, yes, I was an epi fellow. So I was, doing epi backup and also trying to learn at the same time, because I was like, I don't know what any of these data systems are. I didn't know what CalReady was. I had very basic knowledge of how to use some of the stats software. But then also because I had kind of like a clinical background, I was also kind of hopping on and assisting where I could. I did some contact investigations, those kinds of things. And then also I was, I was posed as an epi, but then I was also on the clinical team because there was a lot that we were trying to learn at the time, didn't know much about MPOX. And so I was doing like literature reviews and meeting with our like health officers and doctors every week to try and figure out what policies we should be, instituting.
Okay. Yeah. So you meant it when you said you did a little bit of everything. So real on the ground stuff when you're talking about epi work, contact tracing, that's understanding who all had a confirmed infection, who were they in close contact with, who could have had the disease transmitted to them, reaching out to them, getting them post-exposure prophylaxis, probably tracking all that on an Excel spreadsheet on a line list, probably doing some code. Were you doing coding at that time?
It was a little bit of coding. Things early on were like very messy because, there wasn't a data system to put this into. So people were like most of the disease investigators were either using a fillable PDF or taking notes on a Word document. And then the EPIs were doing all of the data entry so that we could then actually do the analysis on it.
Great. Some informatics work, some data analysis, probably some data visualization, probably some science communication. And then you also had a clinical background, which got you involved in some of the clinical decision making there.
Yeah.
And then ultimately policy. Beautiful. That's public health and, that's the whole continuum of public health work.
So like jumping right into it, it was like a little bit stressful. Every day I was like, what's going to happen today? But then like looking back on it, it was very valuable in that like I truly got exposed to a large breadth of what the public health department did in a very short amount of time.
Great. And then after Cal EIS, did you end up at Santa Clara County?
Mm-hmm.
Okay. So tell me about a time, either clinical or non-clinical, but I think non-clinical would be more fun to hear about, where you felt imposter syndrome, where you thought like, I can't believe I'm here. I don't know what I'm doing.
Oh, that's like most of my job in day to day because as I mentioned, I didn't really have an epi background when I jumped into this. I had, like a little bit of epi from vet school and then the bare minimum from my MPH. Funnily enough, like I remember going through vet school and being like, God, I really do not like epi. I hate all of this math. I like what percent positivity and like sensitivity. I really didn't like any of those things. And so now I find myself in this job. I'm like, what am I doing? How did I end up here? If you would ask me 5 years ago, like, what do you think you're going to be doing? I truly could not have told you.
But for anybody who's listening, you learn it on the job.
Yes.
And it's not a problem. At least generally, it's not a problem.
Yeah.
Okay, cool. And that's fun. I've always enjoyed learning things on the job a lot more than learning it from just a book. I think I like to do both. I like to read and also do the work because you get feedback right away. There's like a lot of pressure to get something right if you have to present it on Monday morning. So it's like, the lessons sort of stick with you a lot faster. So I think these practical, I wish they did more of these hands-on training programs, even in primary training in medical school and vet school. I wish they moved the clinical part a little bit earlier.
Yeah, I will say, like, I tend to also be a very like practical applied person. And so when I'm book learning things, I'm like, why is this important? And if you can't prove to me why it's important, I don't like it. So I think for epi work at the time, I was like, why is this important? I don't think it's like fun or anything like that. I don't see how I can use it in my day-to-day work. And now, of course, I'm like, okay, I guess it built some good foundations.
Yeah, I need to at some point get some academicians on this program because I'm completely with you. I think the people I've talked to so far are practically minded. They want to apply a knowledge base. And that's just a personality thing. It's not better or worse to be academic or to be applied. But if you feel that you want to do stuff, you want to be on the boots on the ground type work, you want to feel the pressure, you want to have some emergency response, you want to act on things, then I think public health is great for that. And then if you could go back and redo your career, anything you would do differently?
I think it's a little hard to decide that because I feel like for the most part, I'm kind of a person that just kind of goes with the flow. I'm like, well, what happened. So not really. I did spend a lot of time trying to figure out where it was that I wanted to be and what it was that I wanted to do. But overall it ended, like I am where I am now and I seem to be having a good time. So I'm happy with that.
Great. And it sounds like, I don't know how similar veterinary medicine is to human medicine. It sounds like it's similar in that you do better on the clinical end if you pick a lane. If you do, like, are the clinical residency programs species specific or at least group, like carnivore or invertebrate or whatever?
Yeah. So, you kind of go large animal, small animal. It's pretty much split like that. But then you can specialize even within there. So you can be like small animal internal medicine, small animal surgery, all of those specialties exist. For large animal, there's not quite as many specialties yet. I think, they're coming, but you can do like a equine internal medicine residency, or you can do a large animal internal medicine, like those types of things.
Got it. But when you leave the clinical realm, suddenly all the doors seem to be open. Like you don't need to do a residency in MPOX or maternal child health. You just show up, demonstrate interest, work hard, and then you can make things happen and make a difference. So that's another reason why I like public health. And I think we have similar personality as far as like whatever happens, I'm going to make the best of it. Because there's a lot of work that needs to be done. Like if ultimately your goal is to improve human health, improve animal health, improve population health, there's stuff to be done. There's important work. And as long as you're open to learning stuff, especially learning on the job, I think you'll have a good time.
Yeah. Oh, for sure. I think this is something that I tell a lot of people who are like, should I go into vet school or whatever? Is like your degree is so flexible. There's so many different things you can do. When you graduate out of school, no matter what you were learning about in school, like, oh, I only learned about dogs and cats. Your license allows you to go and practice on horses if that is what you decide you want to do a career change and do. Of course, it will require that you have some like good mentorship and, learning on the job, but you're free to go and do that too.
You may have just answered the final question here, but for people listening who are clinicians or training to be clinicians, who are interested in expanding beyond purely clinical work, do you have any advice for them?
Find a good mentor.
Okay, I like that. How do you do that?
it can be difficult, right? I think I've been like, as I transitioned to public health, I've been very lucky that I was able to find some good mentors who are able to kind of like, be patient and teach me the steps along the way. Also, something I think is important is, having the ability to say that you don't know something. I think especially for people who are like high achievers, or you've like come up through this environment of vet school or med school where it's like you have to have the answers all the time and that's expected of you. It can be very scary to say, I don't know. But it's okay to say, I don't know. You can. My go-to answer in clinicals when I was in vet school was, I don't know, but I'll go look that up. And I said that a lot.
Agreed. Yeah, I think everything you said is great. How to find a good mentor. I actually don't have good advice. The great mentors I found have always been coincidence. I suppose you can start by finding somebody who had a career that you admire. That they don't always make good mentors. They're not always interested in mentoring, but that's a good place to start. And then what else did you say that I wanted to comment on? What else did you say after that?
Like being brave enough to say, I don't know.
Yes, I think I always took issue with the culture in medicine that so disproportionately rewarded confidence. Like they're training physicians to be con artists, where it's like, the truth is that patients generally respond way better to blind confidence than to nuance. So I guess there's some truth to the utility of that, but underlying, even if you're being outwardly confident, to sort of simplify the message and help with shared decision making, under the hood, you should be thinking a lot about nuance, right? And risk reward and doing all those calculations, number needed to treat, so on and so forth. And so that's something that I never appreciated, but I think there's a lot more room for nuance in public health. Thanks so much, Megan, for being on the show, being our first DVM. This was a super fun talk. I think this will be interesting for veterinarians and non-veterinarians just to see kind of what the universe is like for a vet. And for people who are interested in public health, you'll get opportunities to work with veterinarians most likely. It's a very interesting part. And we didn't even talk about One Health, any specific work, but obviously environmental health, veterinary health, human health is all part of the same universe here. It all interacts, and any logical approach to improving the health of the environment of animals or humans takes all those things into account. And so it's great to get to know people and work with people from different specialties. So thanks for being on the show.
Thanks for having me.
And catch us next episode when I'll talk to another clinician and hear more about their career outside of clinical work.